Hello, my name is Kira. I'm 22 years old. I live in Germany and I study psychology and I have Peutz-Jeghers syndrome, and this is my story. Okay, so my story started at like 14 years old. Got diagnosed before me, so it was kind of obvious that I might also have this disease, and I had like those characteristically freckles around my lips and also around my eye, and but I didn't have any symptoms. So they did, like, the first thing they did was a colonoscopy, and then they found some polyps. That's why I had to do other like procedures, and then like it all started, and then it was like the first time I had to go to the hospital. That was in 2017 in June, and then I went there multiple times. I did like colonoscopy, endoscopy to remove polyps. And then at the same year in 2017 I had my first like ileus. I didn't think much about it, and I think about a week later, this just happened again. I was also at school and like the exact same symptoms. I went home. I remember I went home that day with a friend, and I was just laying in her bed and also like just in so much pain and throwing up. And then my dad just picked me up, and and at home, like the pain at night vanished again. But the third time this happened, I was also at school, and like this time it didn't vanish at night, so that's why I went to the hospital. But I remember thinking it was nothing bad, but like it was really terrible. And then at the hospital they did an ultrasound and also like an MRI to see what was going on there. They weren't really sure about it. And then the next day I was being operated, and the next, like a week later, also at hospital, this just happened again. I remember my aunt came in, and at the exact time I was just like, out of nowhere, just the pain came back, and it was like really, really bad. And again, they did an MRI, and I was also being operated, and my stomach, like my small intestines, stuck into each other about 30 centimeters, and then it just twisted around its own axis. And then they untwisted it and also removed the polyp, so this won't happen again. And then after that they sent me to another hospital where they have more knowledge about that disease, and where they have like different treatment options to do other things like double balloon endoscopy. And then I just had to go to the hospital multiple times for checkups to remove polyps and all that stuff. And now I have to go like twice a year to the hospital to also like colonoscopy, capsule endoscopy, and all that stuff. Yes, I was being genetically tested last year in 2024 in October. And currently I have to go multiple times. So last year I went to the hospital 2 times because for me it's really hard to drink those laxatives. And like last year they scheduled an appointment, but I had to like cancel it because I had thrown up all the laxatives, so you can't do the procedure then. And then I scheduled another appointment, and then they said, okay, they give me an NG tube where they can give me those laxatives via this tube. And it went quite okay, so they were able to do a colonoscopy, but like they wanted to do another colonoscopy, but like there was too much blood, so they had to like stop it. And then like from then 6 months later they scheduled another appointment, and they gave me again an NG tube, but I couldn't really stand it, so I kind of removed it. And they were still able to do the procedure, but they were only able to go from my mouth, so to remove polyps in my stomach or in my small intestines, but they weren't able to go like doing colonoscopy. This year in 2025, I have to go in October to do another procedures like colonoscopy and double balloon endoscopy. Sometimes I have to do an MRI to see if there are any polyps. Other than that, I have to like those screenings for cancer at the gynecologist, or I have to also go to a urologist. I go to my gynecologist like once a year. Last year in 2024, I had some complications with like a cyst at my ovaries that had to be removed. So I went more often, but I'd say like once a year for like pap smear and like the ultrasound. Yes, that's basically it. So I would say it does like have an impact in my daily life, especially like also academically, because sometimes when I have to go to the hospital, I'm not able to go to the seminars, to be there and to like actually learn something. I would say that's kind of an issue, and that's why I have to like do the stuff afterwards. And you know, sometimes I'm like, especially after the hospital stays, I'm like really weak because I'm not allowed to eat for like 4 days. And then, you know, I have to learn for university, for my exams, and then I'm not really able to do so. So that's, I would say it's kind of an issue. I mean, it's a lot, but you can still have a good life with it, and there are good options to treat it. And like there are good centers here in Germany where you can go to, where there are doctors who know a lot about it, and I'd say your life is not over with this disease. I mean, like my grandmother passed away at the age of 75 and also probably had this disease, so it's not like that you're going to die at a young age. So yeah.